All right, so I am in the supply room and I'm looking over my supplies. I checked my orders and the chart, and it looks like we have to do some Trach Care for Casey today. So I have a Trach Care kit. Package integrity is intact. It's not expired, does not contain any aspirin type materials. I have a mask for me and some goggles. Those are clean and new. I have my sterile gloves. I'll say package integrity is intact. They're not expired. And I have my trach ties. Package integrity is intact. They're not expired. I have some sterile saline here. It was open this morning at 7 a.m. so I will have to pour some off once I add that to my kit. Expiration otherwise is December of 2026. There's no particles floating around in there. It's clear and it does not contain aspirin. So I'm going to knock and do my hand hygiene. Hi Casey, my name is Sarah. I'm the nurse taking care of you today. Can you state your name and date of birth, please? And he says, Casey Banks, 10265. Do you have any allergies? Casey says he's allergic to aspirin. All right, Casey, so the reason why I'm here today is we're due to do that dressing change for your trach. Have you ever had that done before? Casey says no. So what we're gonna do is I'm gonna be removing that old dressing. We're gonna take a look at the site, make sure that that looks good. I'll feel around there for a little bit, and then I'm going to do some cleaning. It is a sterile procedure, so I just ask that you not touch my gloves or any of my equipment that I'm using while I do that. If at any point you need me to stop, I ask that you just raise your left hand for me, and then we'll take a break. I'm going to turn your oxygen up a little bit so that it can accommodate for me removing the mask on and off and all of that. Do you have any pain on a scale of 0 to 10 before we get started? 0 being no pain and 10 being the worst pain, and Casey says he's about a 0. He does not have any pain. All right, I'm going to do just a couple of assessments here before we get started. We're going to do heart and lung sounds, looking at the respiratory rate here, and then I'm going to put a pulse ox on your finger. I'm going to be watching your oxygen level closely while we do this. I'm also going to take this pillow out from behind your head, and I'm going to put a towel down just to keep your gown nice and dry. And we're hyperoxygenating to 10 to 15 liters. So I'm going to turn this up here. I'm going to get a pair of clean gloves. So I do my hand hygiene, get my clean gloves on. Okay. So I'm going to unsnap this oxygen mask, and I'm moving it out of the way just a little bit. I'm going to stabilize the faceplate, and I'm removing the dressing very carefully. I'm going to put the oxygen back on. So here I'm just looking for any drainage. If there was, I would note the color, odor, consistency, and the amount. But this dressing is good. So I'm going to set that in the garbage. I'm going to take your oxygen off again. I'm going to stabilize the faceplate with one hand, and I'm just going to palpate around the stoma. So I'm feeling for any crepitus, looking for any pain, swelling, tenderness. Does this hurt if I press around your trach? And Casey says no. I don't want to cross over the stoma, so I'm just moving around the side, and I'm going to put that oxygen back on. I don't have to snap it just yet. I'm just going to leave it there so I can take it on and off during my trach care. So I'm removing my gloves. I'm going to do my hand hygiene again. I'm going to set my trach ties over on the side. We're going to get our mask and our goggles on. Obviously the mask would be over my mouth, but I have it down so that you guys can hear me, as well as the goggles. Those would of course be over my eyes. So what I'm going to do is we're going to open up our Trach Care kit. So I'm opening it up like this, and I'm going to move it around so that the narrow compartment is farthest away from me. So it'll look like that. Okay. I'm going to loosen the cap of my fluids, and then we're going to put our sterile gloves on. So we are going to be putting additional supplies on our sterile glove wrapper, so we need to make sure that we are keeping our wrapper as sterile as possible. So again, staying along that 1-inch border here. Okay. I'm gonna put my dominant hand on, and I'm only putting one glove on at this point. All right, so my first glove is on. Now what I'm gonna do is I'm taking the drape out of my Trach Care kit. Okay. And I'm gonna move away from my table. I'm gonna look for the shiny side. Now be careful how you open it, that it doesn't fall under your exposed arm. So the shiny side is gonna be the side that touches the table. The matte side is what will face the ceiling. So I'm just loosening up my drape here, staying behind it so I don't contaminate. Okay. And what we're going to do is we are going to place this down on our table as an additional sterile field. And I'm just setting that down. Okay, so now I'm gonna come over here. I'm just gonna straighten things out. I'm gonna remove this compartment in here without letting my fingers go below the level of that plastic. I'm going to take my glove out one at a time and just set them on my new sterile field. You're going to have a little scrubby thing that looks like a straw cleaner. We're going to take that out. Make sure that nothing dips below your wrist or goes out of the container. So I'm going to set that right here. Then I'm going to have these things that look like cloth trach ties. I'm not going to use those because I have ones from a manufacturer. So I'm just going to come over here and set this on my sterile field so it's out of my way. I'm going to have 4 pipe cleaners. I don't need those either. These are going to stay with your kits because you will get this in one at your clinical site. I'm going to have 2 Q-tips. These I'm going to set here for now. And then we're going to have a stack of gauze, dressings. Those are going to come out too. So before I put on my second sterile glove, I'm going to pour my fluids off. So I already loosened my cap. I'm avoiding crossing over that. And then I'm going to pour off fluids because this has been open today, so they're only good for 24 hours. So we're pouring fluid off. And we're going to pour some in that first container, the middle, and then the last one without crossing over too much. So got that. You can recap and set that aside. Now that I have my fluids poured, I'm going to put on my second sterile glove. I'm checking the oxygen stats, and that's still pretty good. So I'm putting sterile glove number 2 on. Remember, we're not going to cross over our glove wrapper because I'm putting more supplies there. So I'm going to take one sterile glove. We're going to plop this on my glove wrapper without crossing over, just like that. And then my second glove, just like that. We're going to separate all our dressings. So we have a split gauze that is going to be used last. So I'm setting that separately. So I've got our split gauze, and I have 4 4x4s. Okay, I'm just loosening them up so I can grab them easier. My pipe cleaner brush, one with the big bristles, this is going to go in that canister that I took out, that's separate. And then my 2 little Q-tips are going to go in the skinny saline compartment. Okay, so now we're ready to go. I'm going to bring my supplies just a little closer to Casey, because you can move your feet to move your table. That's fine. And you're keeping your hands in front of you. Casey, we're going to start cleaning your trach stoma, okay? So I'm going to take your oxygen off here, and I'm setting that to the side, and I'm going to stabilize the faceplate. With my other hand, I'm going to pinch the flanges on the inner cannula, and we're going to take that out. I'm replacing the oxygen now. just like that. Our inner cannula is going to go into this first section where our bristle brush is, and I'm going to now clean the inside. We're going to go back and forth a few times because these get pretty gunky, and you want to make sure that you don't splash onto your sterile field. Okay, so I clean the inside, then we're cleaning the outside. You want to get where them little wings are too, so it's easy for that to get crusty. Then we're going to give this a rinse in our middle saline, and just tap it on the side to get any moisture out. Okay, I'm grabbing it by the wings. I'm going to take the oxygen off, stabilize the faceplate, and reinsert the inner cannula. And we're just wiggling it in there. It's going to click back into place, and I'm going to replace the oxygen. So my gloves are dirty from cleaning the inner cannula. I'm going to remove these gloves. So now I'm going to do my hand hygiene, and I'm going to get sterile glove pair number 2 on. Looking at the pulse ox, oxygen sats are still good. So we're getting the second pair of sterile gloves on at this time. Going in. All right. Good. All right, second pair is on. This is going to now become my garbage drape, because I'm not going to put anything sterile on that again. So I'm going to grab one of my Q-tips from my skinny saline section. We're going to remove the oxygen. I'm stabilizing the faceplate. So what I'm going to do is I'm going to clean from the 9 o'clock to 3 o'clock direction, or you could do the 3 o'clock to 9 o'clock direction, but you have to keep that consistent for all of the swipes that we're going to make. So I'm going from 9 to 3 on the top of the stoma without touching the skin or his linen, while stabilizing the faceplate with my non-dominant hand. And I'm going to discard that. I'm going to grab my second Q-tip. I'm stabilizing the faceplate, and I'm cleaning from 9 to 3 on the underside of the stoma. We're always stabilizing that faceplate whenever we have to make contact with it. So I'm taking my first gauze here, going back into the skinny saline, and we're going to clean on the top side from 9 to 3. And your oxygen can stay off during the cleaning portion only, because this typically goes really fast. So we're doing saline again on the bottom, so 9 to 3 on the bottom side without crossing over the stoma. Setting that aside. And I've got a dry gauze. We're going to dry the top from 9 to 3 without crossing over the stoma. And our last gauze, we're going to dry on the bottom from 9 to 3 without crossing over the stoma. So at this point, I'm going to apply my new dressing. So we're just picking this up. We're going to make a little V. We're going to plant this right at the base. Then I'm going to hold pressure on the trach with my middle and my index finger, and I'm going to loop this dressing under the trach ties. Okay, I'm stabilizing the faceplate, stabilizing the trach. So our dressing is back on the patient. I'm going to put the oxygen on for a second, recheck our values. Our oxygen level looks good. So at this point, you could have a second nurse come in. You always need a second nurse to exchange the trach ties. So one nurse would hold the faceplate while the other undoes the Velcro, and then you'll switch as you're applying the new trach tie. So now, I'm going to resecure the oxygen back onto Casey with this snap here. You doing all right, Casey? And Casey nods his head yes. You're gonna put this pillow back under your head. I'm gonna take this towel off. Okay, that would go to linen. And I'm checking your pulse ox again, and that looks pretty good. I'm taking my gloves off here. And I'm gonna turn you back down to your pre-Trach Care oxygen flow. So go back down to 3 liters. In 5 minutes, I'm going to reassess your respiratory rate, your heart rate, and we're looking at your lung sounds and your pulse ox to make sure that that looks good, which it does. So now I would discard my supplies. I'm gonna remove my mask and my goggles. Then we're going to do some documentation. So we're gonna document our assessment, the trach care that we provided, and our vital signs. And Casey, I will come back in about an hour to round on you, okay? Casey says, okay.